Thank you very much for the opportunity to speak to you about how a safe injection site in Kenora will save lives and benefit our economy. As much as it pains me to say it, my hometown has a drug problem. Unfortunately, wherever we go, we see more and more evidence of addiction. When it comes to addiction, no one speaks with more authority and experience than Dr. Gabor Mate. Addiction is neither a choice nor a disease. It is the manifestation of emotional pain, of overwhelming stress, of lost connection with family, friends, with yourself. Research has shown that there is a link between childhood trauma and addiction. Trauma can include physical, emotional, or sexual abuse, neglect, the loss of a parent, witnessing domestic or other physical violence. Whether it's an addiction to cigarettes, alcohol, overeating, or drugs, people who are addicted are traumatized people. A few years ago, one of my favorite students became the poster boy for addiction in Kenora. It was difficult to see. Dulling the pain had become a way of life for him. And this slide is also difficult to see because it represents an 88.9% increase in opioid-related deaths in northwestern Ontario from 2019 to 2020, and a 112.8% increase in hospitalizations due to substance abuse during that same year. That is a heavy burden for our healthcare system to bear. And the economy takes a huge hit in lost productivity due to opioid use. In 2017, lost productivity costs due to substance abuse totaled almost $15 million. In 2022, I'm sure they're much higher. If we don't like seeing discarded needles in our city, then what we need is a supervised injection site. It results in safer communities and allows drug users to get the help they need. Vancouver's safe injection site, Insight, has been open since 2003 and has been shown to be a successful public health initiative in over 30 scientific research reports published in peer-reviewed medical journals. This research demonstrates that Insight users are more likely to seek long-term addiction treatment and to stay off the street than users who choose to inject outside. Instead of using puddle water from urine-soaked alleys, participants are provided with sterile water, which reduces various kinds of horrific infection. A post-injection chill room operated by peer staff and volunteers allows service users to hang out with people with lived experience who listen to participant stories and connect them to additional supports. Staff can refer participants directly to On-Site, located right above Insight, which offers detox and recovery support. The On-Site program is divided into 2 levels, a 12-bed detox floor and an 18-bed transitional housing floor where ongoing interim recovery support is provided post-detox. On-Site connects residents with permanent housing, physicians, mental health professionals, addictions treatment programs, and other external programs, reducing the burden on our healthcare system. Vancouver's safe injection site, Insight, saves the taxpayer in excess of $6 million per year by preventing HIV infection and death. For every tax dollar spent, $4 are saved. Since Calgary's supervised injection site opened in 2018, the province of Alberta has saved over $2.3 million. Most of us will need the emergency department at some point in our lives. None of us wants to wait for the care that we need. So if we can keep people out of emergency rooms, it means that anyone who needs emergency care will be seen faster. And a comment from the Edmonton Police Service regarding safe consumption sites. Our observations and data indicate that these facilities collectively have not increased crime or disorder in the surrounding community. We acknowledge the fact that lives have been saved. Simcoe Muskoka, an area heavily dependent on tourism, has moved forward on a plan for a safe injection site. The Canadian Mental Health Association, in partnership with the Simcoe Muskoka District Health Unit, is currently waiting for federal and provincial approval for their proposed safe injection site in Barrie. One of the tools that the Simcoe Muskoka Health Unit used in their research leading up to their application for approval of a safe injection site was a community survey for proposed locations. Supervised consumption sites bring stability to the community by improving public order and reducing the number of injections taking place on the street. We would all like to see healthcare costs reduced. We would all like to see police costs going down instead of up year after year. We would all like seniors to feel comfortable in our downtown area. It's time. A safe injection site would make all investments past, present, and future more viable. Without it, we are all destined to more problems, misery, and heartache, not the least of which is the users and their families. We took the first steps in that direction years ago with the first detox. It is past time to update that thinking and action. Kenora resident Marianne Nelson. It's time to say yes to a safe injection site in Kenora.